welcome Jackie. Hi. So, here to do this EMDR, and I know we went over some of the preliminaries in our screening before you came to the session. But generally, where we start with client history is to get a sense of what you are wanting to work on in these sessions. So you can tell me as much or as little detail as you're comfortable with, and I'm all ears for this first part.
Well, since everything's been going on with the president and the election, there's been I've been feeling a lot of stress and anxiety and anger. So that's been really hard. It's been tough to deal with in everyday life. Dealing with backlash from people and family. It's caused divides. So the stress, anxiety, and anger.
Okay.
It's also been a trigger.
Yeah. So, if you're willing, Jackie, can you share with me just a little bit of your backstory? I don't need all of it, as we would have done in a clinical intake. But especially as it relates to this work and this issue, is there anything you feel I really need to know about your background and your history before we dive into this?
I think one of the things that really triggers me about the current president is even seeing him on TV. The fact that when it was pre-president time during the election, there was a lot of sexual assault allegations that came out against him. And that is a huge part of my back history in childhood and in adulthood, along with physical abuse.
Okay. So, I don't need to know the entire narrative. What would be helpful for me to know is, have you had previous counseling on this?
Yes.
Okay. And can you just give me a little bit of summary of, the nature of the counseling you've had, if you feel you've worked on a lot of these issues in counseling?
I did have some regular talk therapy. I did have some internal family systems therapy. I did work on a lot of these things. Those things did help a lot. I can't say that it just goes away.
Sure.
But I'm definitely more secure with the issues than I was
Okay.
a long time ago.
And the reason I ask that is that makes me feel better about doing this type of target with your extensive history in, more of this, what I call a contrived setting, doing it as a demonstration and, just over the course of a couple sessions. So, because had you not had previous counseling, there may be even a lot more we would have to do in terms of building your resourcing and all of that. So on that token, talking about resources, that's a fancy name that counselors can use to mean anything good you have going for you. So can you give me a little bit of understanding about some of your strengths, your assets, your resources, or these things that help you in life?
I love yoga, so
Okay.
that's a big one for me. Meditation. I love animals. That's probably my biggest one. That's probably my biggest form of therapy. I have 2 dogs at home. I feel like animals more than people some days.
Amen.
So they give me a lot of peace. I like to rate. I have a good family support system. I have great colleagues. I like nature, so I like to go out in nature, and that gives me a lot of peace and calm.
Okay. So I'll explore some of these issues more once we do the formal preparation for doing our processing work, where we'll, have you do some things like show me which breath exercises from yoga you might like, and we'll try to develop a couple visualizations that we can use. So, but this is helpful background on that. So, related to the current president, you gave me a good kind of sense of your backstory, but what specifically around him and this trigger do you feel you want to work on? It could be a specific theme like the stress, anxiety, and anger. I'm hearing kind of 3 themes in there. Or it can be something specifically about him that triggers you. Kind of where do you see the nature of this work going for our optimum?
I really think a lot of it is the trigger element that comes with him is the narcissism that exists with him, and the male chauvinistic narcissism. It's hard to deal with. It's hard to watch him talk on TV. The kind of like male power, that the combination of 4 male powers that's existing right now is kind of hard to watch.
Yeah, that makes a lot of sense to me. And when we take this history a little deeper on the next page, I'll probably explore that as a theme. So the other big question is, what would you like to get out of doing this work with EMDR therapy? What's your hopeful goal or outcome?
To calm the anger so that I can be more objective in dealing with individuals who are on the opposite side of the spectrum from me, to be able to become more objective and educated instead of so angry.
Okay, I get that. So based on what you gave me on this first page of the history, there are 2 big themes I want to explore further. So it's not important that we go through a detailed chronological history, and really that defines all of EMDR. You can give me as much or as little detail when we do these check-ins. So the 2 big themes that I heard in that first page, and you can correct me if I'm wrong, if you think I'm off base or if there's other themes we have to work on, is the male narcissistic chauvinism and your response to it. Okay. And anger. And they may have some interrelation, but I would like to unpack those a little bit as 2 separate things to work on. Okay, so starting first with the male narcissistic chauvinism. I'm going to give you a list of negative beliefs. And Jackie, is there a negative belief about yourself that encountering such male narcissistic chauvinism seems to stir up in you? You can have 1 belief checked. You can have several checked off. I'll leave you the pad and the pen if you want to make checks or stars for me.
Do you want me to check them or just
Yeah,
tell you?
go ahead and check them.
Okay.
Okay, you can keep the
Okay.
legal pad. Okay, actually I'll take it back because there were 3, so I can make some notes here. All right, I am not safe, I am not in control, and I am powerless or I am helpless. So of those 3, which one seems to have the most charged related to the male narcissism, chauvinism? I am not safe, I am not in control, I am powerless or helpless.
I am. There's 2 closely related.
Which 2 would you say are closely
I'm
related?
powerless and I'm not safe.
Okay, I am powerless and I'm not safe. Okay, so I'm going to give you the list back. And now when we go to the other theme of anger, so as it relates to anger,
Okay.
are there, which negative cognitions would you check off as corresponding with anger? There may be overlap from the first theme, but you can just make a star or a circle or some other kind of symbol as it connects to anger. cannot handle it, I cannot stand it, I cannot stand up for myself. Okay, so they're different, so I'll look at those separately. So let's go back to the male narcissism and chauvinism as a theme. I am not safe, I am not in control, I am powerless, or I am helpless. So which again did you say were closely related?
The I am powerless and read them again, I'm sorry.
I am not safe, I am not in control, I am powerless, or I am helpless.
I'm not safe and I am powerless.
Okay. So of the two, I hear that they're closely interrelated. I am not safe and I am powerless. As you hear them both, as you say them both to yourself, is there one that rings in your body as having even more charge?
I am not safe.
I am not safe. All right, let's work with that. So I'm going to ask you 3 different sets of questions. In EMDR, we call these float back questions, just to try to get enough of the history. Again, it's not every little time in your life, or I shouldn't say little, it's not every time in your life you've believed you were not safe, but what we'd like to get a sense of is the first, the worst, and the most recent. So when you think back over the course of your whole life, is there a first memory that's popping out at you as when you believed you're not safe?
Mm-hmm.
Okay.
Yeah.
Is it something you can tell me, or
Mm-hmm.
something? Okay. Give me a little bit of the summary.
Probably when I was about 6.
Okay.
The guy that my mother was dating.
Okay.
He was just verbally mean,
Okay.
and he had a son that was a little older than me.
Mm-hmm.
So the combination of that.
Okay. Got it. And then also floating back over the course of your life, is there a worst memory that corresponds with believing I am not safe?
Another gentleman and my mother dated.
Okay.
I was probably I take that back. The worst would have been my marriage.
Okay.
My previous marriage. He was abusive.
Okay. And the most recent set of memories or memory connected to I am not safe?
My past employer.
Okay. So, and you can think about this before we actually get into the targeting. This is nothing that definitively has to be decided right now. But of those 3 memory sets, age 6 and the guy your mom was dating, your previous marriage, and your past employer, which one seems to have the biggest resonance to the president? And what the president's stirring up in you?
Probably the first one.
Okay.
It's kind of hard because I kind of walked out.
Yeah.
But the first
Mhm.
one's probably the most.
Yeah, and it's interesting because we can decide when we get to that juncture what exactly you're targeting, because
Mhm.
it's conceivable that we can use President Trump as the target, but the chances are if he's stirring up so much for you connected to that theme, it goes back to something earlier.
Mhm.
So we may get even further using one of these earlier targets. We'll see how you're feeling when we get there. Okay, so related to anger, I'm going to read back what you gave me. And the same idea, I'm going to ask you to listen for which one seems to stir the most in your body. So I am trapped. I cannot handle it, or I cannot stand it. I cannot stand up for myself. I am trapped. I cannot handle it, or I cannot stand it. I cannot stand up for myself.
Worst.
Yeah.
I'm trapped.
I'm trapped. Okay. So I'm going to ask you the same 3 questions, recognizing there may be some overlap to the first theme. So when you float back over the course of your life, when is the first time you believed, I am trapped?
Childhood, like. I couldn't even target one area. It was my
Okay.
childhood.
Got it. And the worst? Is there a worst jumping out at you?
The same thing that was when I was 6 or 7.
Okay. And the most recent time you believed I am trapped?
There's overlap with that one.
Okay.
But it would be my marriage and my last job, but
Okay.
probably my past marriage would be the
Yes. So my felt sense, just looking at this, the initial read of this history, is this age 6-7 memory, because it's tying into both areas, would probably be the oldest place we can start to get the maximum effect.
Mm-hmm.
And then by processing that, we can hopefully take it to a present future scenario about working with your goals connected to the president. But yeah, good work for this first session with it. I have enough of the picture where I can see where we're going with the EMDR. And we'll move on to doing some preparation, because this is a lot, even in history, to have stirred up. And we'll work on some of the skills that you can use for grounding, and if you need to stop or pause at any time during this work, we never want you to feel like you're being forced to go further. So just take a breath for now. Kind of let go of what we just visited, and I like that, being able to just move the body in a way that feels organic. So thank you.